to be antipsychotics. My name is Carlos. First, talking about antipsychotic, first we need to understand what is the mechanism of action. This is a generalization. Is gonna be blocking of D2 receptors. Also keep in mind atypicals are gonna interfere with the serotonin or norepinephrine levels here. What is gonna be the clinical use? Is gonna be to basically schizophrenia, psychosis, and sedation. For example, the patient is agitated in the emergency department. We want to calm the patient down, so we inject the patient a shot, and the patient are gonna be sedated. Also, many antipsychotics are gonna be used for movement disorders such as Huntington disease, Tourette syndrome, bipolar disorder, OCD. A typical antipsychotics are gonna also be used in anxiety or depression. Antipsychotics are gonna be divided in typicals and atypicals. Typicals, they are gonna be further divided in high potency and low potency. We're gonna see next. Typical antipsychotics are gonna be, is a generalization, liposolubles. So meaning like those are gonna be storage in the fat. The body, the body is gonna take longer until the elimination of this drug from the system. Also, it's gonna cause increased levels of prolactin levels. Why is that? Because we are blocking D2 receptors, and as we know, like in the pituitary gland, if we block those D2 receptors, they're gonna increase the prolactin level, causing weight gain, galactorrhea, hyperglycemia, also causing dyslipidemia. Also, those atypical are gonna cause problems in the heart, uh, pro, uh, with a risk of causing long QT syndrome and neuroleptic malignant syndrome. High potency and low potency. High potency are more probably to cause extrapyramidal syndrome. What are those? Are acute dystonia, akathisia, bradykinesia, and tardive dyskinesia. If you want me to talk about more about those extrapyramidal symptoms, are gonna be in different lectures, but we're gonna see here rapidly. Acute dystonia is hours to days of start to taking this high potency typical antipsychotic, and basically it's torticollis. Akathisia is restlessness. Bradykinesia is the same thing that a Parkinson's disease patient is gonna have. And tardive dyskinesia is basically those chorea type movements. By the way, most of the treatment for those side effects of extrapyramidal symptoms are going to be anticholinergic, such as benztropine. Low potency. Basically, those are more prone to cause anticholinergic symptoms. Are gonna blocking histamine receptors or alpha 1 receptors. What are gonna be the symptoms of blocking those type of receptors? And anticholinergic are gonna cause dry mouth, constipation, acute urinary retention, and antihistamine are gonna cause sedation, and alpha 1 receptor blockage. Those are going to cause a postural hypotension, hypotense, or ejaculation problem. So imagine we give to a male patient and we are blocking alpha 1 receptors. These patients are going to have probably could have like ejaculation problem, so it's not a good idea. Or imagine this patient is a elderly, a senior citizen, so and we give like an anticholinergic, low potency antipsychotic, meaning like could probably cause anticholinergic side effects. So the patient are gonna be complaining with constipation, acute urinary retention. Another side effect that is worthy to keep in mind is like those antipsychotics is gonna decrease the threshold of seizure. So if we give those antipsychotics, these typical antipsychotics, to a patient who is suffering for seizure, it's not a great deal because the threshold of for causing seizure is gonna be lower. So the patient is gonna be at risk of more seizures. High potency, which one we have here? We have basically three. The more common are triofluperazine, flufenazine, and alloperidol. These three of those come with a tablet presentation, but flufenazine also comes injectable and alloperidol also injectable. Why is important to know that? Because, for example, the patient is not compliant with the medication, so we can administer every month this medication, and the patient are going to be stable. Alloperidol, we have two types. Why? Because this lactate we use when the patient is agitated. We administer a shot, and the patient is going to be calmed down. And this depot Decano 8 we use every month. In the low potency, we have also a tablet per mouth, and also intramuscular. This chlorpromazine is also used in the similar fashion as metoclopramine for nausea, vomiting, sedation, hiccups, etc. So keep in mind. As I mentioned, alloperidol, when we have like an agitated patient, we can use a shot of this for calm the patient down. So this is gonna be the dose if you want to learn that, because actually it's not as common as it was, because right now we have typicals also intramuscular injectables that we can use in the emergency department, but eventually you use like 2 to 10 millimeters intramuscularly every 1 to 4 hours. Maximum of the dosage is going to be 20 milligrams per day. What does that mean? That we can use up to 4 ml in the patient per day. Atypicals antipsychotics. Basically, atypicals are going to be the first chosen in the treatment of a psychotic patient or schizophrenic. Those atypicals are going to be more effective on the negative symptoms of schizophrenia. Remember, schizophrenia has both two types of symptoms, positive and negative. Positive meaning like the patient is psychotic, delusions, hallucinations, or the patient presents with bizarre behavior or speech. And negative symptoms is basically the patient is isolated, the patient doesn't show any affect, meaning the patient is flat affect. So those atypical antipsychotics are going to be more effective on those negative symptoms of schizophrenia. Also, as I mentioned, atypical antipsychotics are going to cause problems in the heart, a risk factor for causing long QT syndrome. But those atypicals, in contrast with the typical, are going to cause less extrapyramidal symptoms and less anticholinergic symptoms. For example, the patient is an elderly patient, elderly who is suffering of a benign hyperplasia of the prostate. So if we give a typical antipsychotic, probably could cause like acute urinary retention, because but if that is why we choose in the early patient those atypical, because it cause less anticholinergic symptoms. So for understanding the side effects, what is important again, because antipsychotics are chosen based in the safety profile, but not in the efficacy. Efficacy. Atypicals who ends in PINES are more common to cause metabolic syndrome such as hyperglycemia, dyslipidemia, weight gain, and the atypicals ends with "don't" suffix are more prone to cause movement disorders or cardiac problems such as a long QT syndrome. First, I wanted to talk about this atypical antipsychotic. It's called clozapine. Why is this important? By the way, here we can see the brand name. Why is this important? Because this antipsychotic is going to be the most effective for schizophrenia, and this we use when the schizophrenia is treatment resistant. So meaning like we already try other type of antipsychotic, and the patient is still having the same the patient is still symptomatic, so we can use clozapine. Also, when the patient is suicide, schizophrenia associated, for prevention of that. But why we don't use it in the first line, being the most effective? Because the side effects we have to learn is agranulocytosis. This is pretty important because if clozapine causing agranulocytosis, we have to do a CBC before starting the treatment and weekly during the treatment. Also, this clozapine, as many antipsychotics, is gonna be causing seizure. It's gonna decrease the threshold for causing seizure, myocarditis, and also keep in mind this is ending in pain, so meaning this clozapine is 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 causing metabolic syndrome as well. So there's a various type of the atypical antipsychotic. So the best way to learn the atypical antipsychotic is, is learning what is the peculiar thing about each one. For example, quetiapine, also known like as the brand name Seroquel, only comes a tablet per mouth. But this quetiapine is going to be the most sedating of all atypicals. For example, the patient has insomnia, so we want some antipsychotic that cause a sedation, so we can use quetiapine. Also, is the least that cause the least causing movement disorder, so it's the safest. For example, the patient has risk of Parkinson's disease, we can use this quetiapine. But this is not entirely true because there is a new drug called primavaserine, or as its brand name Nuplacid, that is FDA approved for a Parkinson's disease related psychosis. The next one is going to be Risperidone. As I mentioned, this is important because we have an injectable that we can administer every 2 weeks. This, so meaning the patient is not compliant with the medication, so we can administer every 2 weeks this antipsychotic and the patient is going to be stable. Also, keep in mind this risperidone is causing insomnia, so meaning like the patient is sedated but he wants to wake to be more awake, so we can use this risperidone. Also, it's going to cause this increase in prolactin levels. We already see increase in prolactin levels is going to affect with essentially, if there is a female, it's going to cause amenorrhea. If it's a man, it could cause like galactorrhea, also decreased libido. Also, this risperidone is going to cause more movement disorders, as we saw before. Also, another antipsychotic atypical is going to be paliperidone. Also, this it comes with a depot presentation that we can administer every month. But this is the difference. Risperidone we can administer every 2 weeks. This paliperidone we can administer every month, so it's more beneficial in a non-compliant patient. This is the Invegas Sustenta, is gonna be the brand name. The next is gonna be Olanzapine. Olanzapine, by the way, it comes besides being it comes in a tablet. Also, olanzapine is used frequently in nausea and vomiting prevention, but also comes injectable. When the patient is agitated, we can use that. By the way, I remember we can use olanzapine for when the patient is agitated. Also, this ciprasidone that we are gonna see later, and remember haloperidol. But which one we use first? We use first atypicals. Why? Because typical has a lot of side effects. So if the patient is agitated in the emergency department, we're gonna first choose olanzapine, then we can choose ciprasidone, and then we can choose haloperidol, the third option and the last option. Olanzapine is the highest that causing like weight gain. So the patient is a little bit overweight. It's not a good idea to use olanzapine because it's gonna cause more weight gain. But if the patient is skinny, we can use olanzapine to promote this weight gain. So it's very like what we want to do with the patient. Also, this the another antipsychotic have to talk is lurasidone. This is important because this is going to be the safe in the pregnancy, and is going to be the safest low QT syndrome prevention. Why? Why is it that important? That is the safest causing long QT. Why is this important? Because in the pregnancy, we're going to choose first this. Also, the next one is going to be aripiprazole. This also, we can say, is the safest in not causing long QT syndrome. By the way, all of those can cause long QT syndrome, but those are gonna be the safest: lurasidone and aripiprazole. Aripiprazole is the lowest to cause metabolic syndrome. For example, the patient is overweight, we're gonna choose first aripiprazole. Also, ziprasidone. Ziprasidone, as I mentioned, with olanzapine, are gonna be in a agitated patient, as well as alloperidol. But this is the highest to cause a long QT, so it's not a good idea if the patient has a cardiac problem to use ziprasidone. The best option to use in a cardiac problem patient is using this aripiprazole, or if the patient is a pregnant woman, we can use lurasidone. And the pimavanserin, as I mentioned, is FDA approved for using in the Parkinson's disease related psychosis. So this is all. So a quick recap about this topic is gonna be useful. Mechanism action: blocking D2 receptors. Clinical use: schizophrenia, psychosis, sedation for an agitated patient. Also, other uses such as bipolar disorder, movement disorder, OCD, and atypical depression and anxiety. For example, depression with the psychosis, we use antipsychotics and antidepressants. Antipsychotics is going to be divided typicals and atypicals. Typicals: high potency, low potency. The side effects are going to be specifically dyslipidemia, weight gain, metabolic syndrome, essentially. Are going to be storage in the fat, also long QT. These are going to affect, are going to cause by typicals and atypicals, and neuroleptic malignant syndrome. We're going to talk this neuroleptic malignant syndrome in the next lectures. High potency are going to specifically, the tendency is to cause extrapyramidal symptoms, and low potency, more anticholinergic, antihistamine, in blocking alpha-1 receptor. So this is a bad decision we want to use on an elderly patient. Also keep in mind that alloperidol, it comes in intramuscular, that we can use every month, as well as risperidone and paliperidone. But keep in mind, it's better to use a risperidone instead of a alloperidol. But paliperidone is used every month. Risperidone is used every 2 weeks. So we see what is the compliance with the patient, and we choose. Atypicals is the first use in a psychotic patient, but those has more effects in metabolic syndromes or movement disorders, cardiac problems. And also keep in mind, clozapine is the best for schizophrenia, but it's not the first use because the side effect, especially granulocytosis. For that reason, we have to take a CBC before using clozapine, and weekly, because if we see a granulocytosis, meaning like the patient is having an infection, we have to withdraw this drug from the patient. And this is the different type of atypicals. We mention here specifically quetiapine is, for example, is the most sedating when the patient has insomnia, and the lowest to cause movement disorder. For example, we first use a typical, for example, aripiprazole in a patient, and it causes, it says it causes like an extrapyramidal symptom. So the next one could be a quetiapine, because this is the safest for causing movement disorders. Risperidone, keep in mind, this is causing insomnia, so in a sedated patient is good option, and increase the prolactin levels as well. but this is not a good idea if the patient already presented with a movement disorders. This paliperidone is worth to keep in mind because this is gonna be could be administered every month. So in a non-compliant patient, we can use this. Olanzapine is the most causing a drug of weight gain, so it's not a good idea when the patient is already overweight. Lurasidone, keep in mind, safest in the pregnancy, safest in the low QT, as well as aripiprazole. Aripiprazole is the lowest in metabolic syndrome. Also, we didn't talk about gambling. It could be a side effect. Ciprasidone is the most of causing long QT, so meaning like if the patient has like a cardiac problem, it's a bad idea to use ciprasidone. Pimavanserin is useful in an FDA approved in Parkinson's disease related psychosis. So this is all. This is antipsychotics. In the next future, I'm gonna come with uh, further more lectures about this topic. Thank you for watching, and thank you. Bye bye.